If you know the enemy and you know yourself, you need not fear the result of 100 battles. Not knowing where the coronavirus is at each moment can be as daunting as playing chess blindfolded. Your turn.
As symptoms are specific, we have tests. What test, who to test, and when to test is the key. When SARS-CoV-2 infects a person, it enters respiratory cells and replicates. As days pass, it leaves traces of what's happening. Now, it's time to do an RT-PCR test. A sample of nasopharyngeal fluid or sputum is taken. We isolate the RNA of the virus, obtain its complementary DNA, and make billions of copies that we can detect. PCR is like a policeman. It looks for the virus and tells you whether you have it or not. Doing massive PCRs to a population will point out who is infected and can transmit the disease even if asymptomatic. Governments can then implement policies of isolation, protect the most vulnerable, and prevent health system collapse. After the 7th day of disease, PCR is positive in 100% of patients. From then on, it gets negative little by little. At the same time, the immune system generates antibodies to fight the disease. Serological tests measure IgM and IgG antibodies in the blood. These tests are like detectives. They look for clues the disease has left and tell you whether you have had the virus. On the one hand, rapid tests. They consist of passing a blood sample through a membrane which contains bands with SARS-CoV-2 antigens specific to the IgM and IgG antibodies. The bands change color when the antibodies in the sample bind to them. Results can be obtained in 10 to 15 minutes on the spot, which allows to test plenty people. On the other hand, indirect ELISA, more sophisticated and reliable. It is performed in wells coated with SARS-CoV-2 antigens. If there are antibodies in the sample, they will bind to the antigens and can be detected quantitatively. IgM and IgG antibodies appear around the 8th day and peak on the 18th day approximately. IgM indicates active infection and is undetectable after the 6th week. IgG titers stay high for a long time. You have recovered from COVID-19 and now have certain immunity. This is extremely important. People who have gone through the disease potentially don't need vaccination and can go back to their normal lives. The point is, by testing a small part of the population and extrapolating conclusions to the rest, we can strategize, learn for the future, and ultimately save lives. Checkmate!